Hello again. I hope you enjoyed my brief explanation of what chiropractic is. For those of you who want to know a little bit more, I'm now going to go into more length about some of the other theories and what is possibly a more truer version of what's going on when you have a problem and when you see a chiropractor, and hopefully you get better. Now, as I mentioned, the theory in a nutshell is that when a joint slips out of place, it puts pressure on a nerve, the nerve firing to the organ or to the tissue stops working, and this results in ill health. And when a chiropractor comes and adjusts the spine, takes the pressure off the nerve, you get better again because the nerve and the organ are talking again. However, recent discoveries over the last 10-15 years in neuroanatomy and neurology, the study of the nerves and the anatomy of the brain, have told us that it's far more complicated and far more exciting than that, because your brain oversees the whole of the functioning of your body, your hormones, your memory, how well you think, how you communicate, your immune system, everything. But your brain itself has a small area called the cerebellum, which is at the back of the head, and within the cerebellum there's a tiny, tiny part called the vermis. And think of the vermis as the foreman of your brain. Now, the vermis oversees coordination. It oversees speaking, because that's part of coordination as well. It also coordinates memory and learning. It also coordinates your immune system. So it's the real hub of how everything works. And the thing that keeps your vermis working is stimulation from other parts of your brain and your body. And some of the biggest inputs into the vermis are from the top of the neck, and some from the base of the spine, but also every single one of the joints in your spine, every single one. Now when you move your spine, you fire into the vermis and it keeps your vermis awake. It's like cups of coffee in this day and age. However, the top of the neck is like the most potent cup of coffee you could ever imagine. So if this joint stops moving, it's like your foreman is lacking one of the necessary stimulants to keep him awake and on the job and making sure that everybody else is doing their jobs correctly. And these are like the lesser cups of coffee. So this is like the one in the morning that gets you going, and these are all the things that keep you going throughout the day. Now, if you have a joint that gets stiff, it means you have one less dynamo firing into the brain. And most people have stiffness in quite a few joints that build up over years, and most people have spines that are still almost the entire day long because they sit in these things all day long. And so the spine gets hardly any movement at all, and so there's less firing into the brain, so the vermis doesn't work as well as it should do, and this has a knock-on effect on your immune system and the rest of your health. Now this explains why people who exercise are a lot more healthy than those that don't. That's why athletes have 5 times less cancer than non-athletes, because they're moving their body, they're moving their spine all the time. This fires into the brain and really helps keep them healthy. Also, people who are active and move more have better memories, they learn better, they retain things for a longer amount of time. Chiropractic is, I suppose, 21st century answer to lazy man's exercise. It doesn't replace exercise, and exercise can't replace chiropractic, because once the spine, part of the spine is stiff, the only people that are going to move it are going to be chiropractors, whereas exercise is going to stop it happening again with any luck. So what we do as chiropractors is we find and locate the stiff areas, and as we get them moving, it fires into the brain more. So it doesn't matter what's wrong with you, if any of these joints are stiff, it's going to inhibit your body's ability to heal as well as it should do. So if we get the more joints we get moving, the better you're going to work, especially the joint at the very top of the neck. That is absolutely key to the whole of your health. I mean, people have now found that when this joint isn't moving, it can cause headaches, it can cause memory problems, it can cause dizziness. But also just recently, if you can search for this on YouTube, there with a doctor that's just done a series of tests on high blood pressure, and he's found that when you get this joint moving, high blood pressure can decrease more than if you just use a drug. So very exciting. And there's a couple of medical doctors down in Australia that have found the more you adjust this joint, the more you keep it moving, the healthier their patients are becoming. First of all, they get rid of neck pain and then dizziness, but then things like blood pressure, hearing, memory all improve as well. And that's medical doctors doing that, not chiropractors. So if you'd like to learn more about these theories and how they work, then you can go to our website, www.thepainreliefcenters.co.uk, or you can just ask us directly, or just search on the internet for chiropractic theories. There are lots, but I think the theories that hold the most water are the ones that actually come from neurology, neurophysiology and neuroanatomy. I hope that's helped you. Best of health to you.